My name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with small intestine, large intestine, liver, gallbladder, and pancreas ailments, continuing with the letter U. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions, then I'll move on with ailments of the brain and nervous system. Then I'll address issues with your skin, nails, hair, eyes, ears, nose, teeth, gums, lungs, respiration, heart, blood, circulation, muscles, bones, joints, esophagus, stomach, duodenum, small and large intestine, liver, gallbladder, pancreas, kidney, and bladder. Then ailments specific to women and then specific to men. Then issues of the hormones and the metabolism. Then homeopathic remedies for infections, infestations, and the immune system. Then issues surrounding fertility, pregnancy, childbirth, and postnatal problems. Then homeopathic remedies that address special problems in infants, ailments and diseases in childhood, and special issues of adolescence. And finally, special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it's recognized that people will react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus, or Arsenicum album types, those who react strongly to Arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, Nature-Muir people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. As another example, Lycopodium types tend to be tall, ganglion, of stooped appearance, with an anxious expression and a craving for sweets and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings. An account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitude towards life. This is what is meant by constitutional treatment. I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So, let us continue with learning how homeopathic treatments can help with small intestine, large intestine, liver, gallbladder, and pancreas ailments that begin with the letter U. From the stomach, food enters the duodenum and small intestine. The food is then squeezed into the cesium through a small valve, then passes into the ascending, transverse, and descending parts of the colon, or large intestine, and finally to the rectum and anus. The total distance between the stomach and the anus is about 26 feet. The whole journey takes 18 to 30 hours from the time the food leaves the stomach. The liver and pancreas empty their digestive secretions into the duodenum through a common duct, the bile duct. Bile produced by the liver emulsifies fats, and enzymes produced by the pancreas get to work on proteins, starch, fats, and sugars. The liver does many things besides aiding digestion. It stores glycogen, a compact form of glucose. It also manufactures A, B, D, E, and K. It removes toxins, for example alcohol, from circulation. It manufactures blood proteins and blood clotting agents. It synthesizes cholesterol, which is a vital component of all cell membranes and the precursor of many hormones. It converts saturated fats to unsaturated fats when the body is obliged to use fat rather than glucose for energy. It breaks down and recycles the iron-rich oxygen-carrying pigment hemoglobin. It dismantles excessive amino acids and excretes their nitrogen-containing components into the blood as urea. Urea is one of the constituents of urine. It also produces a great amount of heat because of all the chemical reactions going on inside it. The pancreas is a gland about 6 inches long, lying beneath and behind the stomach. It produces large amounts of sodium bicarbonate, as well as digestive enzymes. Sodium bicarbonate is alkaline, and therefore neutralizes the hydrochloric acid produced by the stomach. It also produces 2 important hormones, insulin and glucagon, which controls sugar uptake by every cell in the body. The gallbladder has no secretory function. It merely stores and concentrates bile sent to it by the liver and empties it into the duodenum in response to a hormone that is secreted whenever fatty food leaves the stomach. The small intestine has 2 functions: to complete the food breakdown process and to absorb nutrients into the bloodstream. Although it is only 21 feet long, it has a total absorptive area of about 200 square feet. This is because its inner walls are lined with millions of finger-like projections called villi, each containing blood capillaries and tiny tributaries of the lymphatic system called lacteals. Amino acids, glucose, and small fat droplets, vitamins, and minerals pass into the capillaries, and larger fat droplets into the lacteals. Whatever remains unabsorbed by the small intestines, about 5% of the fats, 10% of amino acids, fiber, some vitamins, bacteria, intestinal secretions, salt, water, all pass into the colon, where it's gradually compacted into semi-solid feces. The bacterial population of the colon manufactures vitamin K, B12, B1, and B5, and certain amino acids. These are absorbed by the walls of the colon, together with salts, water, and other valuable substances. Transit time through the colon depends mainly on the amount of roughage in the diet. Too little roughage causes constipation and related ailments such as hemorrhoids and diverticulitis. Ulcerative colitis. Ulcerative colitis is a fairly rare condition in which the lining of the rectum and colon become progressively ulcerated, causing periodic attacks of left-sided abdominal pain, diarrhea, mucus, and blood in feces, and in severe cases, fever and nausea. Complications include anemia, as the ulcers bleed, and septicemia, as toxins from the ulcer get into the bloodstream. The risks of developing cancer of the rectum or colon are slight. The cause is not known, but the condition can be aggravated by broad-spectrum antibiotics. The diagnosis is made by a barium enema and endoscopy of the rectum and lower colon. It is conventionally treated by steroids. In severe cases, steroids and nutrients may have to be given intravenously to rest the colon and allow it to heal. A colonoscopy or surgical removal of the affected part of the colon is a last resort. After a first attack, constitutional homeopathic treatment is recommended. Specific remedies: to be given every 2 hours for up to 10 doses during acute attack while constitutional treatment is being sought. For hot stools that smell offensive and have blood and mucus in them, with cutting pains upon passing them, and the abdominal pain is not relieved by passing stools, use Mercurius Corr 6C. If the person is chilly, restless, and anxious, with burning pain in the abdomen, accompanied by vomiting, and the symptoms are worse after midnight, and they want warm drinks and sipping them at frequent intervals, use Arsenicum 6C. If there is blood in the stools, and passing the stools relieves the pain, but the anus feels wide open afterwards, use Phosphorus 6C. Self-help. Further attacks may be prevented by changing to a high-fiber diet and reducing the intake of milk and dairy products. Be wary of antibiotics. If you have a bacterial infection and consult your doctor, remind the doctor that you have a history of ulcerative colitis, and stop smoking. I have a great many videos now on many different topics, so I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.